A coronal brow lift involves elevating the eyebrows through an incision along the top of the head behind the hairline. So how that's done is an incision is made basically ear to ear on the top of the head. The tissues are lifted up going down to the eyebrows. The tissues then pulled tight and stretched backwards to elevate the eyebrows and tighten up the forehead. The advantage of this technique is that the scar is on the top of the head, and if you have hair there, it's hidden in your hair. The other advantage is that you're less likely to have any numbness along your forehead or upper hairline because the incision is so far back. Another advantage is you don't need any hardware or plates and screws or any fixation devices anchored into your skull because the tissue is suspended up in place by removing the extra skin. So the skin removal is what allows it to be held in place and maintain its position. The number one downside of this operation is that your forehead gets longer and your hairline moves back. So I have a receding hairline in the front of my head. I would not want a coronal brow lift because it's going to pull my hairline even further back as it lifts my eyebrows. And if I continue to lose my hair and go bald, I'll have a scar that goes ear to ear on the top of my head. Now, a lot of guys don't care because they're tall, and so if you're a taller person, there's fewer people that see the top of your head, but that's something to keep in mind. So that is a coronal brow lift. It involves incision ear to ear on the top of the head, and the skin and scalp gets pulled up along with the eyebrows, lengthening the forehead, moving the hairline back a little bit, and the final scar is on the top of your head. To learn more about other techniques of brow lifts, check out my other videos that describe the other brow lift techniques. To learn more, check out our website where you can upload your photos and concerns as a virtual consult. You can also check out our price estimator to get pricing information for all the various procedures we offer. And finally, if you'd like to have your questions answered on a future podcast or Q&A video session like this, please leave a message on our SpeakPipe. You can go to our blog page and our SpeakPipe is located there. Thanks for listening.